we're not going to come to the day where the WHO is invading countries that refuse to grant it access. That's just not going to happen. If China insists on blocking access the next time a virus starts, in somewhere inside China, it is incumbent not only on the World Health Organization Director General and the World Health Organization staff, but all the member states of the World Health Assembly to denounce that obstructionism. In other words, the rules and the regulations are there, and I think they can be strengthened. They can give the organization more authority. But more importantly, the member states of the World Health Organization have to be prepared to use the leverage in their arsenals to pressure countries to respect those rules. It wasn't a shortage of proper rules and regulations that allowed China to obstruct the World Health Organization investigation for too long in January of 2020. That wasn't a problem of the rule book. It was a problem of China, first and foremost, being obstructionist, not being transparent, being more concerned about its reputation than about averting a global pandemic. And that's something that China should be held accountable for. But it was also a problem of powerful countries like the United States itself flattering China, not working either behind the scenes or publicly to put pressure on China to change its posture. And it was a problem of international civil servants being too polite. There's always going to be a phase where you try private diplomacy and you try to work behind the scenes to get countries to open up in the way that they need to. But there has to come a point, there has to be a line in the sand where when a country is continuing to block, to obstruct, when it is not sharing information in a way that is in the global health interests of the world, where international civil servants are prepared to raise their voices. And that day should have come much sooner, and in the future, I hope will come much sooner.